Hello everyone, it's Dr. Ace here, and today we're diving into a topic that's far more common than you might think. It's balance issues. What are the reasons that happens, and what are the solutions for the balance issues? Now, let me ask you, have you ever had one of those moments where you're walking down the street, maybe you're lost in thought, and suddenly you trip over nothing? I think we've all been there at some point. And perhaps you felt that this sensation has been getting worse and worse as you get older. You see, while stumbling in your youth might have been brushed off with a laugh, it can feel a little bit more concerning as you age, right? And start to noticing it more and more frequently. I remember a patient, let's call her Mary. She was in her late 60s, and she came to me after a series of falls. She used to be so active. She loved gardening and taking her grandkids to the park, but slowly these falls started happening more and more often, and it got to the point where she didn't feel safe leaving the house anymore. Can you imagine how would that feel? To go from independence to living in fear of a simple misstep? Today we're going to talk about 13 reasons why this can happen and 10 things that you can do to get ahead of it, so you don't have to live your life in fear like Mary once did before we treated her. First, we need to understand balance issues. Losing balance isn't just about clumsy movement. No, it can come with a whole host of symptoms. Some people feel faint. Others experience a sensation like the room is spinning around them, or even that they are floating. Have you ever felt one of these? Tell me in the comments below, okay? Each sensation can point to a different issue, and understanding why you're losing balance is the first step to solving the problem. I've worked with many patients over the years who have dealt with these challenges, and in each case, the treatment and the understanding of the disease is unique. However, the reasons often connect in ways that you might not realize. Let's dive into some of these common reasons and share some stories that can help paint a clearer picture and understand this disease that affects so many people. Now, imagine standing perfectly still, yet feeling like the world is spinning around you. One of my patients, David, came to me with this very issue. He told me, "Doc, I feel like I'm on a merry-go-round that won't stop." It turns out he had labyrinthitis, an inflammation of the inner ear. Vertigo often stems from these issues with the vestibular system, the part of your ear that controls your balance. When the vestibular system gets inflamed, whether from a viral infection or something like Meniere's disease, your whole world starts to feel off-kilter. Now, I remember another patient, Linda, who would always feel lightheaded after standing up too quickly. This might be something you feel. She would get up from the couch and suddenly she would try to grab something to steady herself up, and sometimes she couldn't do it and she would fall on the ground. That's orthostatic hypertension, a sudden drop in blood pressure when you stand up, and it becomes more and more common with age. If you've ever felt dizzy when getting up from the bed or a chair, you know how unsettling this can be. It is as if your body takes a moment too long to catch up with your head. These can lead to frequent balance issues, especially as your heart doesn't pump blood as efficiently with age. Speaking of vestibular system, as we get older, the cells in this part of the inner ear slowly die off. I once had a patient, an 80-year-old patient named, let's say, Frank, a retired carpenter, who prided himself on being steady on his feet his whole life. But as his vestibular cells started to decline with age, his body's ability to react to sudden movements slowed down, and suddenly he wasn't as sure-footed as he used to be. These can make even the simplest tasks, like reaching for something or bending down, feel unstable. Now, the only cause of your instability is not only problems in the ear, there are also problems in the vision. Vision plays a crucial role in maintaining balance because it helps us judge depth and navigate obstacles. Conditions like cataracts or glaucoma can cloud your vision, making it harder to stay steady. A blurred vision makes it difficult to navigate your own home, and simple things like walking up the stairs or stepping off curbs become a huge challenge. There are also muscle weakness. You might not think about your muscles as a key part of your balance, but they are absolutely essential, and as we age, muscle mass decreases, and this loss of strength can slow your reflexes down, making it harder for you to catch yourself up when you stumble. A good way to protect yourself here from this is getting into the habit of exercising daily. You will not only feel more motivated but also stronger and less prone to falling. I'm gonna talk about other ways to prevent this at the end of the video, okay? So stick around. Medications. Many of my older patients, like Linda, are on several medications for blood pressure and antidepressants, even sedatives. What many people don't realize is that these medications can indeed cause dizziness as a side effect, which can seriously affect your balance. Linda's blood pressure meds were making her lightheaded, but once we adjusted them, the balance improved dramatically. It's essential to keep track of your medications and how they can affect you, especially when multiple drugs are involved. There's also dehydration. It is another hidden culprit that I often see and that patients hardly ever notice. Not drinking enough water can lower your blood pressure and cause dizziness. The problem is most of us don't know how much water we're drinking. I had a patient, Susan, who thought her dizziness was due to medication, but it turned out she simply wasn't drinking enough water. A few extra glasses of water a day were all it took to improve her balance. Dehydration is easy to overlook, but it's a simple fix that can have a big impact. There's also anxiety or panic disorders. I treated a patient named Claire who had been experiencing bouts of dizziness during panic attacks. Anxiety can trigger dizziness because when you are anxious, your breathing can become shallow, reducing the amount of oxygen that reaches your brain. Claire would feel like the ground was shifting beneath her during these moments. After addressing her anxiety, her balance improved significantly, showing how interconnected our mental and physical health can be. Now, if you are diabetic, you know how much blood sugar levels can affect your body, right? John, a 60-year-old patient, started noticing his balance issues after experiencing numbness in his feet, a common symptom of diabetic neuropathy. Without the ability to feel his feet properly, John was losing his connection with the ground. Keeping blood sugar levels under control is essential for managing these symptoms and improving balance. If you want to learn how to control your diabetes and avoid that outcome, remember to subscribe. Now let's talk about Steve, who was diagnosed with Parkinson's disease. Parkinson's affects the brain in many ways. It affects the way the brain communicates with the body, making balance and coordination much more difficult. Steve had always been active, but as his condition progressed, he found himself struggling to stay upright. Neurological conditions like multiple sclerosis or stroke can also have a similar impact, disrupting your brain's control over balance. There's also joint problems and arthritis. I also had a patient named Evelyn who had struggled with severe arthritis in her knees. She told me, "My knees just don't bend the way they used to." Arthritis can be painful and make it painful to move and generate stiff joints that reduce your ability to react quickly, which is critical for maintaining balance. There are also heart conditions. Let's talk about heart problems. I had a patient, Tom, who had irregular heartbeat, also known as arrhythmia. This means that his heart wasn't pumping enough blood for his brain, and he would often feel dizzy or even faint. Heart conditions like arrhythmia or heart disease can dramatically affect your balance by limiting the flow of oxygen-rich blood to your brain. Now, let's talk about the solutions. I gave you the problems, I gave you the reasons for losing balance. Now we're going to cover the solutions, the 10 solutions that can improve and will improve your balance and regain the control of your life. First, it's important to talk with your doctor, okay? If you notice recurring balance problems, they can help you figure out the root cause. And a good doctor will be capable of figuring out if it's related to medication, inner ear issues, or something else. Remember David, who had vertigo from an ear inflammation? A simple treatment plan resolved his dizziness. There's also the need of medication adjustments, okay? If your medications are contributing to dizziness, ask your doctor if adjustments can be made, just like Linda's blood pressure medication. Small changes in dosage or switching up to a different drug can make a world of difference. There's also the need of physical therapy in some cases. Balance can be improved with specific exercises like Tai Chi, yoga, strength training. They can help you regain the stability you need. Balance can be improved with specific exercises like Tai Chi, yoga, or strength training. And some of these exercises you can do in the comfort of your own home. There's also the need of hydration. Drink plenty of water and maintain a balanced diet. Staying hydrated can and will prevent dizziness, just like we did for Susan. There's also the need of regular vision checkups. Your vision plays a huge role in balance, so make sure that you get your eyes checked up regularly. A new pair of glasses or cataract surgery will make a huge difference in your balance. There is also the need of improving your home. Simple modifications in your living space can and will significantly reduce fall risk. Install grab bars in the bathroom, improve lighting, and get rid of tripping hazards. Also, you need to strengthen your muscle. Muscle weakness, as we talked about, contributes to instability, so incorporate strength training into your routine. Even light resistant exercises can help maintain your strength and improve balance. Vestibular therapy exercises can retrain your body to manage dizziness better. Now, here's the conclusion. Don't wait until it's too late. Balance issues might be a part of aging, but you don't have to live with them. By identifying the root cause, whether it is a medication side effect, a chronic condition, or simply because you're getting older, you can take steps to improve your stability and keep doing the things you love daily. So if you've been struggling with dizziness or balance problems, don't wait to get checked out. You deserve to feel safe and steady. And if this resonates with you or someone you love, hit that subscribe button now and don't miss future tips. Don't forget to leave a comment below. Tell me, have you experienced any of these symptoms? Your story can help others that are going through the same thing.